Type 1 diabetes is usually diagnosed in children and young adults. To help those diagnosed with the management of this condition, the Diabetes Association of Barbados hosts Camp Pride, an annual summer camp for children with diabetes. Consultant pediatrician Dr. Paula Lashley, who has been working with children who have diabetes for some time, has been a facilitator for the 2-week camp for the last 3 years. She explains the difference between type 1 and type 2 diabetes.
People know diabetes as sort of an adult disease. The type 1 diabetic are those that are usually diagnosed under the age of often 20, but generally under 40, and usually always children. And they are insulin-dependent diabetics. So even though adults may take insulin, this particular group of diabetics have to have insulin to maintain their life. Symptomatology, generally speaking, would be a child who is passing urine frequently, who starts wetting their bed when they weren't accustomed to wetting their bed before, who's drinking quite a bit, who may be losing weight. And then there's some other little subtle things like the child who in adolescence starts to get unusual vaginal fungal infections, or seems to be not being able to concentrate at school for some odd reason. Those children then should also be tested. Most of our children diagnosed with type 1 diabetes are diagnosed in their either early adolescent years, like the 12-13 age group, but we have another peak that comes at around 4 to 6. So even a very young child at about 4 or 5, if there's suspicion, you definitely should be checking to see.
Dr. Lashley describes what the illness does to the body and what causes these sudden symptoms to occur.
We have an organ called the pancreas. It's situated just around the same area as our liver, so it's fairly far behind, so you can't feel it when you touch your abdomen or examine anyone. And this organ produces a hormone called insulin. And unfortunately, there is a genetic basis behind it to some extent, but also we seem to have from our research worldwide that there may be a trigger that puts people who are predisposed to have type 1 diabetes at risk of then going into a diabetic state by often a viral infection or some unusual stress response. So the body normally will be producing insulin, and this viral infection or the stress response prevents the pancreas from producing enough. So the little cells that produce this either go into a little shock state and stop producing at all, or they start producing very diminished quantities, which then over time lead to an insulin deficiency. So that's why it is different than the adult disease, where the insulin is still present but just not working effectively. So this is a lack of insulin in these particular patients we're talking about. But when we don't produce insulin, our body's glucose levels rise completely. And what happens with glucose is it's excreted in the kidneys. But the kidneys take water with it when it tries to excrete the glucose. So passing more urine is then because that glucose is being excreted into the kidney system. And then obviously if you're passing a lot of fluid, you get more thirsty. So lots of thirst and lots of urination together, that package is one of the big warning signs that tells us that diabetes may be present.
With type 1 diabetes, insulin must be given, either by injection or using a pump.
In the last, I would say probably 10-15 years, the methods of injection have changed. So instead of having to draw up in a big long syringe, we have extremely tiny microfine needles. So shorter and tiny than a little common pin literally causes very little discomfort. And then these are attached to either a syringe, or they can be with a pen where you can just dial up and inject in. And then you mentioned asking about something like a pump. A pump is a continuous supply of insulin, but it has to be attached to the patient. It can look like a little pager or a tiny, one of the smaller cell phones, and it'll be attached like in your pocket, or you'd have to put it on in like under your skin, and it would have to be attached permanently. The pump is then filled with insulin, and you can set that pump to deliver a certain amount of insulin per hour, every few hours, give it a little bit more if you need, and so forth. The advantages of a pump are it does give you freedom to do a little bit more, but it means you have to be much more careful with monitoring. So it's not just something that you can just lightly go into. And also the pumps are probably costing around $40,000 for your plus your supplies on a monthly basis.
Camp Pride began in 2002. It was initially designed to allow children with type 1 diabetes and their siblings without this illness to come together. About 5 years ago, after the involvement of advocate Crystal Boyer, the camp became more focused on the needs of children with diabetes.
Some of our children, particularly the older ones, were so isolated. They didn't have nobody else in their school was diabetic. They never knew anyone else was. They didn't even know that diabetes existed other than themselves. So going to camp was just a way to say, well, I am normal and this is okay and everybody else looks the same as me and we could do everything. So the camp has really taken off. We are managing about 20 campers a year, which is about 50% of the registered diabetics that we have with the Diabetic Association. And there are varying reasons. Some don't want to come every single year because they think we're doing similar things. And then each year there may be about 4 or 5 new ones who come in. So there is a turnover of people. And what has been extremely nice to see is that some of our older diabetics, those who were diabetics as children, who are now young adults, have been coming back in to help in the camp.
A balanced diet, exercise, supportive families, and good mental health help these children to better manage their illness. Nutritionist and diet and meal plan coordinator Nicole Griffith emphasizes the need for a balanced diet.
That is very important because based on the things you eat, it could trigger a high blood sugar or a lower blood sugar. And you should be able to, in that diet, be able to count the calories and the carbohydrates you're going to actually put into each meal. One thing that I want them to take away is that they don't have to always have potatoes. I mean, find that children like a lot of English potatoes, and there are so much other things that they could use instead of English potatoes, which are not so high in carbohydrates. The other thing that I wanted to take away is that you don't need to have this. They came to the camp with this idea that they have to have meat if they're having some type of pie that has in cheese. That's the next thing I want them to go away thinking about. If I have macaroni pie, I don't need to have chicken with that macaroni pie. And to at least have something with vegetables, whether if they put it in the meal or if they have it beside of the meal or with the meal. And we allow them to put together the plate they would usually eat on a daily basis. And from that, then we calculated how many calories they would have had using, we gave them a sheet. And we said, well, 1 slice of bread is equal to this, and well, apple is equal to this, or half of an apple is equal to this. So then from that sheet, then they were able to calculate, because it comes in cups and tablespoons and ounces. So they were able to calculate, well, if I had 2 cups of mashed potatoes and an apple, and then I had a cup of juice, then I was way over my carbohydrate amount. So they kind of catch on, but then because it's a usual thing for us in Barbados to eat so many things together at Sunday lunch or Christmas. They are so accustomed to doing it that it's something that they know, now the 2 weeks are coming to an end, they're like, oh, we're actually not going to have this today because we had this. So I think they're getting into it. I guess with more practice, they'll be able to get it done better.
11-year-old camper Rain Billet was diagnosed when he was 2.5 years old. He offers some advice to persons with and without diabetes.
I have been coming to this camp for 2 years, and I've enjoyed being with other diabetics and knowing that other people are just like me. I've learned from them how to control my diabetes better and to eat healthier foods and a bunch of other things. You don't really need these sweet things. They're not very healthy for even a person without diabetes. And now that you have it, it's incurable, so just accept it and accept who you are.
At the time of this interview, Emma Thomas Field had only found out that she had diabetes a month ago. She admits that at first she was unhappy, but she has quickly adapted to her new life and its routines.
At first I felt sad because I thought you could die from it, but then I realized that if you don't handle it well, that you can die or get complications. You're still normal. You can still eat sweets. You just have to think of how much you're allowed and you have to do the carb countings, but you're still the same.
The disease also became a life-changing experience for Emma's mother, Betty Field, who recounts her reaction to the news that her daughter was a diabetic.
It was devastating, to be honest with you. I felt as if somebody had ripped my heart out of my chest, because she is my pride and my joy. She's my only child. And the thing is that when when she was diagnosed, like, I heard the words coming out of the doctor's mouth, and all these things just started to swirl around in my head, and then it really hit me, and I crumbled. That's the honest to God truth. And it was hard, but you know what? I took a moment to compose myself. The doctor asked me if I wanted her to break the news to Emma, and I thought at that point that that was the better thing to do, because I did not want to project my feelings onto Emma, because all Dr. Lashley kept telling me is that this is not the end of the line. This is now 2014. Treatment for diabetes is not what it used to be 20 years ago, and she gave me some hope. And this is one of the reasons why I chose to let Emma come to camp, because I also wanted her to learn from other people's experiences, and especially kids of her age or younger or older, and let her see for herself that, you know what, this is not the end of my life. There's so many people out there, so many great people, which she has learned as well, because from band members, I mean, Crystal Boyer right here. We also met Dr. Holmes in the hospital, who, you know, came and they chatted with Emma, and they have been a great inspiration in showing her that she can live her life as normally as she possibly can. Just remembering, of course, that she's diabetic, and she has to have her insulin, and she has to have it, and she has to do her checks and balances.
13-year-old Shaquan Andrews has this advice for children who receive this diagnosis.
Confide in someone and find somebody who could comfort you, because like a lot of times it's really hard to deal with, because you feel like you can ask yourself a lot, why this happened to me, and like why it had to be me. But you just have to like understand that you just have to go with it, because it's like a lifelong disease, and you have to get used to it and put it into your daily routine.
Monisha Sidney has been attending the camp for 4 years. She admits that the diagnosis was, and sometimes still is, difficult for her to accept.
When I first found out, I hated everything. I think I just went into like a spiral, a depression. I didn't really talk to anybody. I think I was in shock. I don't know. I think sometimes it's still, for me, I still can't believe that I have it. But, you know, I go through it every day. I was diagnosed right before I was about to do the 11+ exam. So when I got it, I was going into a completely different environment with completely new people. And obviously a lot of my friends would not have been there. But there were some people that knew. And when I went into the classroom for the first form, my teacher was like, oh, okay, so she's a diabetic. And everybody just knew just like that. And I was just like, God, did she have to tell everybody? But everybody knows. I think they were surprised at first, but it didn't treat me any differently. I appreciated that a lot. I really did. Take every day one step at a time, because every day is a challenge. It does get easier, but the reality that you have to face it, I don't think that gets any easier. But you just learn to deal with it.
Dr. Lashley stresses that the management of type 1 diabetes relies on support from the community, teachers, and family.
People are scared. They're scared of needles. They're scared of thinking that a diabetic may go and faint on them, or go hypoglycemic, which is when their blood sugar drops too low. But once we have given that education and given people the ground to stand on, so they know how to manage, then they take off and they know how to manage it. Remember that this small group of people have this chronic disease for the rest of their lives. There's nothing we can do about it. They have to be on insulin. They're going to have to maintain a healthy lifestyle with their dietary management. And they go through the same problems that every other person does. They're going to have the same adolescent woes. They're going to still want to get married and have children. They're going to want to have a glass of wine and a fancy occasion. And they still want to have Skittles occasionally. And it's not that they can't, but they have to fit it in. And that's the main message.